parents and families and staff and everyone. We are going to welcome you back to Building Bridges, and we are looking so forward to it. We hope that you are well and that you have done well through this time. I'm going to be sending you an email with all the details about what's going to happen, but I wanted to give you a summary. First of all, for those of you who don't know me, my name is Janice Pagano, and I'm the Clinical Director of Building Bridges. We have worked tirelessly and endlessly in making sure that those of you who choose the option to return to the clinic feel safe and protected. So I'm going to tell you a little bit about that now. First of all, the parking lot will be much different. We are going to have a health screening there. Everything will be one way, so you'll come into the parking lot, you will stop at a designated place for a health screening, and you will be asked some questions, and everyone needs to answer the questions. So if you bring 10 people in your car, everyone will need to answer the questions, and everyone will get their temperature taken. So for your child to come to therapy, everyone in that car needs to pass the screening. So you'll know that when you come, maybe you just want you and your child in the car. At the health screening, you'll have your temperature and your questions, as I said. Once you pass, then you will be assigned a parking spot to wait for your therapist. So the therapist will come out and get your child and bring your child into the clinic. We have closed our waiting room. For any of you who've been in our waiting room, you know that for sure there's lots of people and lots of things going on, and right now that's not accepted. So to keep you safe and us safe and everyone safe, the waiting room is closed. So we are going to ask that if you are here for a 30-minute session, that you may stay in your car and wait. If you are here for anything longer than 30 minutes, that you go and take a nice ride and come back for pickup, because we just don't have enough parking spaces for everyone to park. No one will be getting out of their car. So when you get your screening and the therapist comes to get you, we ask that everyone stay in the car. And if you're waiting for 30 minutes, bring a coloring book, because you're going to be staying in your car. We are going to have no exceptions to the health policy to keep everyone safe. So we wanted you to know that. If you're an adult in the car, we ask that you wear a mask, and everyone in your car would wear a mask. If your child won't wear a mask, we get it, because we will have all our protective gear on and we'll be safe, so we're not concerned about that. We know that children, especially special needs kids, may not wear a mask. If you are coming, we ask that you arrive 5 to 10 minutes before for drop-off, and just maybe 5 minutes before pickup. So remember that now that you're returning, you have two options of therapy that we are offering: teletherapy and in-clinic therapy. So either one is going to be safe for you. If you feel like your child may not separate from you, then do some pre-planning, because you will not be allowed to walk your child in. Your therapist will walk your child in, but we want to keep everyone safe. We're asking you to just prepare your child that their therapist will walk them in and walk them back to the car. So we're excited about these. So look for my email for lots more details, and we'll see you soon.